And here we have the actual RFK unveiling of the plan that has all these people up in smoke. So let's check this out.
We stood and signed 6 additional SNAP waivers. Louisiana, Texas, West Virginia, Colorado, waivers for what? States to stop the selling of sugary drinks and junk food. But in those states, no longer can you use taxpayer dollars to do it.
That's the point. That's the key point right there. It's the taxpayer dollar part. We don't, well, first, I care a little bit if you're using food stamps and you've been on the system for years. I care about that. But I don't care if you eat fat food. I don't care if you eat sugar. I don't care if you drink soda. I don't care what you do. I care if it's taxpayer dollars and you're eating like that. You're eating like a king while I'm over here scraping by. That's a problem. So yeah, I'm glad they took the candy off.
It is being called a major win for the MAHA movement. It is a major win. It's not just being called that. More states removing junk food from SNAP programs, that's food stamps, prioritizing real nutrition over processed snacks, sugary drinks. That brings the total to 12 states, so 12 so far, all restricting SNAP purchases of unhealthy
You know, the great state of Florida had to be in there.
foods, beverages, under the
I see you too, Texas and Louisiana, Indiana as well. Good job.
new USDA waivers. Caroline.
They might as well start a graph right now with the weight correlation per state, per capita, and we're going to see how these food stamp waiver states are going to decrease in the midsection. You're going to see some decreasing in the midsection and an increase in health. So it's a win-win for everybody.
Will it be 50? No.
No, it's not. It's not going. I'm not really sure how this is going to play out. But I think zooming out here, the fact that SNAP is for low-income Americans, I think is the biggest point. Because for a long time, I think we assumed as a culture that Make America Healthy Again, all these attempts at organic eating, holistic living was a luxury that only the higher echelons of society could really afford. But the stats don't lie. 25% of SNAP dollars go to candy and soda. That is a moral abomination. It used to be that during the Great Depression era, when you think of poor Americans, you think of undernourished, starved people. It's actually the opposite now that they're overnourished.
They're obese. Call it like it is, woman. These girls are big. They got 6 kids, all as big as them, little mini versions, just big old folks. Unlimited candy, unlimited snacks, unlimited soda. My kids might get a drink of soda once a week if they're lucky.
In a way that causes heart disease and hypertension and an obesity.
If you think about it, though, it is kind of just playing into the whole system, right? Make you fat, keep you dumb. You go to the hospital, big pharma gets paid. It's one big repeating cycle.
Crisis. If we're going to subsidize food in America for those who are the most needy, that's fine. But we shouldn't be subsidizing an obesity crisis. And this is the first step in the right direction to actually remove those incentives, because we know that the food companies, especially the junk food companies, are in Congress all the time lobbying.
I was just thinking this. You know, all those junk food type people's stocks were going to be falling.
To keep basically the SNAP benefits, because they know that at the grocery store checkout line, a lot of these low-income Americans in these very, very disadvantaged communities are buying crap.
Yeah, I actually was taking a libertarian view on this until I read those stats. How much, because I was giving an example of like,
you can't take a libertarian stance on this because the tax dollars are coming out regardless. So let's cap it. I mean, even if they just, I don't even think they're taking the cap off of some of these folks. I think they're keeping, let's say you got a $400 every 2-week limit. They're just saying you can't buy junk food with it anymore. I don't think they took away anything off the top. That's what I really want them to do, but one could hope and pray. Let's see what happens.
a single mother who has SNAP benefits, and now she'll be deprived of her right to buy her kid a Coke. But I'm talking about one Coke. When 20% or 25% of your SNAP benefits are being used for junk food, sweets, and sugary drinks, it's crossing a line. I mean, ultimately, these benefits are provided to provide people with nutrition and they are making bad decisions. I still think there's an educational element to this where people have to learn to make those decisions for themselves. But in the meantime, I remind everybody that the SNAP benefits are taxpayer dollars. These are tax dollars that we give to people to nourish themselves, and soda is not nourishing.
Yeah, I'm with you. Changing availability or access doesn't necessarily change behaviors, but at least it's a step in the right direction. It's always appalled me when you go through the store and you can see that this is SNAP or EBT eligible at the junk food that it is. But again, I say that from a privileged position of maybe spending too much time digging into.
I'm pretty sure there's people getting like their nails done and stuff with these EBT benefits, nail and hair. So I think this goes a lot further than just getting snacks and junk food.
What's in that? So there is an education component that we have to do a better job. But this is the first point. Cut off the easy access, then start educating why you should be making different choices. And then that plays in.
They know every time they look in the mirror, they should be making different choices. They don't care. They're fat and happy.
Like with Bloomberg, I never agreed with his soda ban. You know,
or salt ban.
We ban things, people will buy 5 small sodas or whatever it is to be able to make up for it. If they don't understand why soda is bad and they can't make that choice, then that's really the core issue.
But you know why I used to just bitch, complain about Bloomberg. And my husband said, "You're going to hate it when he's gone." and
you did.
It was followed by de Blasio. Yeah.
Right, exactly. And so I ate my words.
Yeah.
But the reason that Bloomberg was so fixated on sugar and salt was because of the costs, the healthcare costs to the city of New York, because the city runs a hospital and healthcare system. And then also the insurance cost on all of the city employees. And that is a huge financial burden.
Yeah.
He was like, so we need to start focusing on making the people who work for the city, who go into city hospitals and healthcare clinics, somehow get them on the road to better health, because it's going to bankrupt the city.
Well, and that's what
See, this is good. It's a step in the right direction. Finally, the taxpayers are making their voices heard loud enough that our representatives are taking action. And make America healthy again is a real thing. Something we never focus on in this country is preventative health care measures you could take, like working out, exercise, just getting up and moving, and diet. Those are huge things. And when you do those things, even just regularly, a couple times a week, you're going to see a lot less of a burden on the taxpayers when it comes to both healthcare and those EBT benefits. And you'll be surprised. You start working out, all of a sudden you get motivated. You might want to do something else you didn't want to try before. So maybe you'll just get off food stamps altogether. Who knows? If you made it this far, like and subscribe. I really appreciate you.